Well, I was explaining to Becky over here about use of morphine, fentanyl and ketamine. So sometimes a driver can assist in the paramedic in drawing up these particular drugs. So I've gone through them with Becky, but very briefly, for pain relief we can give morphine or we can give fentanyl, so one or the other. We don't give both generally, although you can give both if you need to, but it's preferable that you use one over the other. Fentanyl's the preferred opiate to use over morphine if possible. It has less side effects. One of the side effects of morphine, of course, is nausea, so we routinely give metoclopramide or Maxilon for that one, as we've shown before. So morphine's 10 milligram in 1 ml. Okay, we dilute that with 9 mils of normal saline and in 10 ml syringe, and we tape the ampoule to the syringe. Yep, so we can dilute. If we're giving that IV, okay, we can also give morphine IM. So we start off generally 5 milligrams, so IM. So we don't need to dilute it. So we just draw it up 1 mil and give half of that, 0.5. We can give that IM. Or if we're going to give it IV, we start off generally with 5 milligrams IV. We can, for an average adult, we can up that dose to 10 milligrams IV. Okay, got to be careful with elderly people because morphine's a respiratory depressant. Okay, very elderly people, so say in their 80s or so forth, you wouldn't anywhere you'd probably start at 2.5 milligram IV and see what effect that has. Doses above 5 milligram can cause them to go into respiratory arrest. You know, and we've had multiple cases where we're called to GP offices where the little lady's gone in, doctor's given them 10 milligram of morphine and they've gone into respiratory arrest and we have to ventilate them. So that's the danger of morphine. So fentanyl's a lot safer drug to give. So we have 100 micrograms. And remember in ketamine we said they've got milligrams, so it's milligrams, whereas in fentanyl it's micrograms per ampoule in a 2 ml ampoule. So we dilute that with 8 mils of normal saline to make it up to 10 mils in the 10 ml syringe, okay, and tape the ampoule to the syringe so we know what it is. The dose we start off is 50 micrograms IV, so half of the initial ampoule dose, right? Or 50 micrograms IM undiluted. Okay, obviously you don't want to give IM a diluted amount because you're pushing in all that saline into tissue. So IM is always undiluted if we can. Our doses we can give further 50 microgram doses. So we've got two 100 microgram ampoules. So we can give up to 450 microgram doses IV or IM up to a maximum of 200 micrograms, which is the 2 ampoules, okay, if we need to. On top of one of those agents, fentanyl or morphine for pain relief, the opiates, we can also then add ketamine. Okay, ketamine is an anaesthetic agent and has a nice dissociative effect and is a good adjunct to both morphine and fentanyl. The only time we do not give ketamine is for cardiac pain, cardiac chest pain. Okay, that's the only contraindication. So I'll write that down in a second. Contraindication, ketamine is cardiac. So do not give for cardiac chest pain. So it's generally for trauma pain. All right, and we have 200 micrograms in 2 mils. Sorry, milligrams. The ketamine's, the fentanyl's micrograms. Ketamine. So 2 mils. Easiest way to dilute that is with the 20 ml syringe. So now we've got the 20 ml syringe in the IV kit. And we can dilute it into 100 milligrams in a 10 ml syringe, but then if we tape the ampoule to that, then the other syringe won't have a marker on it as to what it may be. And or if we've leave the 1 ml left in the ampoule, it can be easily spilt or lost. So it's preferable that it's diluted to a 20 ml syringe, which we've now got, with 18 mils of normal saline, okay, and administer slowly. So it has to be administered over about 2 to 3 minutes to reduce the dissociative effects. Okay, so we try not to give it quickly. The dose is 10 to 20 milligrams of that. So when we dilute 200 milligrams with 18 mils of normal saline, okay, we've got 10 milligrams per mil.
Yep.
Okay, so we can give 1 mil to 2 mils for pain relief, or 2 to 3 mils, 20 to 30 milligrams for procedural. If we're doing something procedural, so like for instance, if we want to, we're applying a traction splint on somebody who's got a fractured femur or something like that. Something where we are going to, by our actions, we're going to increase the pain or might increase the pain. We can give a slightly higher dose. Okay, there's no top limit for ketamine. We just got to be careful that we don't put them in what's called a K-hole. Okay, so we limit the amount of ketamine that we have. Okay, a K-hole is where they have the dissociative effect kicks in, that it becomes scary. Becomes scary for the people. They're not sure where they are. They're totally disoriented. So we're trying to avoid that. Okay.
Yep.
Yeah, so generally the maximum dose of ketamine is the 200 milligram. It's generally, we probably won't need any more than that together with the fentanyl, and obviously we titrate those drugs to the patient's response to the pain.
Yep.
Okay, you happy with that?
Yep.
Okay, so it's great if you could, drivers don't have to, but if they could memorise those three things, when a paramedic is busy with a patient with pain relief, that the other medic can draw up those drugs in the syringe, and you always check with the paramedic that that's the right drug and the right dose. Excellent. Thank you.